Eh.
Don't you ever besmirch Billy.
Oh, whoa. Where'd you go? Oh, the slow down speed and blood is, whoa, cool, not cool. I just see a lot of blood.
Blood?
We got lots of blood in our body, right? Many liters, many pints of blood. You can survive, maybe if you lose just about half, you're at the cusp of like death and survival. What are we looking at? It almost looks like when I went and saw Body World or Body Exhibit where they do the plasticization of humans, like anatomy, and it's just the blood of the body, all the blood vessels in a liquid casing. That's kind of like what it looked like.
I can't stop. 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 I can't stop.
What the heck? It's like very dark blood. So most of that blood was probably venous blood versus arterial blood, which is a lot brighter. Robin? Oh my gosh. Robin? That is awful.
That's awful.
On the arms, the tissue, appropriately shown, it's not just like perfectly cut off, it's all jagged. When somebody gets an amputation, and if the tissue is all kind of rough and beat up, it's very hard to reattach, versus if it's perfectly cut.
Шлюха не в себе, ненормально.
Oh.
Пиздец!
What? What? Oh my gosh. Ripping off the skin of someone's face. The amount of strength that it takes is a lot. You got to be able to dig into the tissue, rip off the skin. But looking at the anatomy, they did a pretty good job. Teeth, obviously, you can see some gums. The nose. Your nose! Probably difficult to recreate because the nose is bone only at the top part and then it's cartilage down below. Oh. Oh, what is, come on. Come on! The classic like cervical fracture. High cervical injuries can cause the autonomic nervous system to cease to function and don't get any signal pathways to allow yourself to breathe or to have your heart beat. So that's typically how somebody dies in this circumstance. Oh. Bullets, useless, bro. I would just run. She was shot several times and nothing happened. Just because you got shot doesn't mean something bad's going to happen. You can have soft tissue injury, goes through and through, doesn't hit anything. It can hit the bone, it could hit a major blood vessel, even though it looks like it's just going through flesh. What?
What?
Did that gun just get impaled right into his forehead? The amount of strength to be able to break through the bone with a very blunt object like that. I've never seen injuries like that. Obviously, I've seen bullet wounds, but not blunt trauma from a weapon that's stuck inside someone's head. Whoa, gross. Acid vomit or something like that.
It's got a wonderful defense mechanism.
Oh, gross. It is. It is. Oh. Vomit on your own face? The pH of our stomach contents is quite low. It's very acidic. You can get ulcers, and then we have to give medications that potentially change the acidity environment. But if we're changing the acidic environment, then we're changing what's naturally supposed to be going on in your body, and then how you digest food might be changed as well. How did that acid kill the individual? Your GI tract can tolerate it. So did it go in your airway and your airway can't hack it? And then is it melting into your brain and is it dissolving your brain? Oh, that's pretty good. A headbutt to the face and the nose, and they actually show that there's like an laceration to the nose. Okay, I'm impressed.
Impressive.
Oi, oi. I don't think there's anything left with that strength. With that amount of punching and trauma to the face with this guy's right hand, you can fracture all this area of your face, all the bones around your eye, the zygomatic arch, the frontal bone here. You can do this sinus pocket right here, part of your maxilla. Normally, the most common car accident type injury is literally a pedestrian versus car, not a pedestrian and car getting dismantled by superpower eyeballs. Oh, man. I don't know what this like goopy clotted blood looks like. Maybe it got clotted because of the amount of burned energy. Typically it wouldn't be sloppy Joe mixed like that. Your brain material would actually be a lot more gray white. It wouldn't just be all red coated in blood like that.
Where's my son?
Oh, wow. Cut in half. It reminds me almost of like Mortal Kombat. You can see the different brain material. You can see the cerebrum, the cerebellum. I'm assuming everybody's, yep, he's coated in blood. Oh, geez. If somebody gets exposed to another person's blood, especially if it's a mucous membrane, you want to wash out those mucous membranes. And if it's a needle stick as well, you have to worry about HIV versus hepatitis.
I'm the upgrade.
Whoa. Obviously, if I got hit like this, I would be having a lot of broken bones and not feeling well and not get up anytime soon.
I'm not feeling good at all.
You really had me going for a minute there.
Crushing somebody's airway, you can cause enough trauma to the airway where it's difficult to get air in, as well as you're decreasing blood flow to the brain in and out by squeezing on each side. When we actually take someone's pulse in their neck, we actually don't take it on both sides. This guy's strong. We have patients that are so strong, we have to hold them down with multiple different people. We have security at the hospital. You actually want to give them a medication that can actually just calm them down. Oh! I'm assuming they were trying to kill him. Whoa, cool.
Okay.
Get to the prostate.
So he shrunk down to then get to his prostate. Your prostate is a gland that sits just below the bladder, around the urethra. It produces the fluid that basically nourishes your sperm when it gets ejaculated out. Oh! Oh my gosh! I did not expect that to happen at all. Holy cow. We literally have like the tissue of the lower part of the abdomen still kind of wiggling and moving. What we don't get to typically see is like all the fecal matter. It's not really good for TV, but it's actually quite realistic if it was there. But most of this is just blood and intestines. Wow. So people come to the emergency department, significant amount of abdominal pain, and they always worry about their intestines bursting open. It could happen, but typically due to a perforation, the body is actually quite impressive that it can actually take a lot of stretch because all the organs, everything we have is basically like muscle.
Hi. Can you please break my arm? Vicky will smell it if I fake being sick, so it's gotta be real and it's gotta last for days.
Whoa. When they document really bad fractures for like people in the news, they always say compound. In the medical field, we never use the word compound. We use comminuted to describe if a bone is in multiple pieces.
That. Right here. Clean break. No permanent damage.
Clean break, no permanent damage. So trying to go like proximal forearm, you have your radius and your ulna. Those are the two bones of your forearm. What are we doing, like an Indian bird? Don't rotate. Snap. You kind of need a fulcrum unless you're superhumanly strong, which I know they are.
1, 2.
Wow. The likelihood that the bone didn't actually rupture through the skin is pretty low, actually. Because of this type of fracture, the bones snap and they're super, super sharp, and it would actually most likely rip through the skin with that much amount of angulation. Oh, ow. could actually fracture the maxilla here or your infraorbital wall. If you have a fracture and you sneeze, the air that you would normally sneeze out actually then escapes into the skin and it actually just swells up really fast. Not good. Not good. Oh, jeez. Oh my gosh. All these characters are soups. They have a lot of power. But as mere mortals, how can we get an advantage? Check out my product, Level Up for Energy and Focus. The noises that whoever created this decided to make an exploded head just be like juicy.
Juicy.
These type of injuries typically don't come to the emergency department. Where would we normally see these? Gunshot wounds, and these are also like bad car accidents where there's like decapitation, bad injuries, that sort of stuff. Oh, geez. Punches epigastric area through the sternum on the left side. Everybody tells me in the comments that the heart is in the middle of the chest. It's actually in the middle left part of the chest.
It's all over.
Blunt trauma to the chest can cause significant amount of injuries where it stuns the heart, it bruises the heart. If you actually have bruising to the heart or bruising to the lung, not good. It's not like the bruises that we see on our tissues.
It's all over now. There you go.
They did a good job of depicting this. Even though your heart stops, you will have a few seconds where there's consciousness, somebody will pass out, and then there shortly after, if nothing is done to fix it, you will succumb to the injury as you don't continue to have circulation.
God damn it.
If you have trauma to the chest cavity itself, increase the risk of fracturing a rib. A rib could then actually puncture your lung, causing a pneumothorax or a hemothorax or a combination of the two. Oh, somebody pulling her through a brick wall. I mean, if anybody gets thrown through a brick wall, that is a human.
I'm a human!
It's going to cause a significant amount of destruction to your body, break some bones, open up some wounds. Oh, jeez. Strangulation. Oh, actually, pretty good depiction. When somebody gets strangled, two different mechanisms are occurring. Blood vessels on either side. You got your carotid artery going up. You got your jugular vein coming back. And then you also have your airway. If you continue to hold after somebody passes out, that's when you have the increased risk of killing them. Oh, nice. See? Passed out for a second, but then was able to regain consciousness because able to get oxygen back in the body.
Was that an almond joy? He has a tree nut allergy.
Come on.
Come on!
How many of you out there are allergic to tree nuts? Let me know in the comments. That would be pretty darn fast to have an anaphylactic reaction. If you have a history of anaphylaxis, then you need to carry an EpiPen on you. Looks like there was an EpiPen there. Appropriate. Wow.
Homelander, wow, It's an honor, sir.
Hold on. You can tell it's me? Wow. That's impressive.
Now, you don't need super eyes when you have super ears.
Good thing to quickly talk about. So we have all our senses, right? One is actually taken away, like Daredevil. Your potential senses on the other ones that are still intact are a little bit more heightened and you're able to focus on them a little bit more.
I just have one question, if that's okay.
Yeah.
Yeah?
Yeah.
Oh gosh.
All right. So, what happens if, I don't know, I do this?
Oh! That is a significant amount of blood to come from somebody's ear. So what happened? Compressive forces, basically massive amount of trauma to the eardrums, rupture the eardrums. The eardrums have blood vessels, so you will start bleeding.
And now you're just another useless blind guy.
What could potentially happen now is permanent hearing loss, or it actually can go back to normal. You can actually have the eardrum heal, and most of the time they heal on their own, and your hearing goes back to normal. What the heck is that? Obviously, this does not come into the emergency department, but we do see people get chest trauma the other direction. Kind of common thing that we do worry about is a car accident where somebody has a sternal fracture. Getting slammed on a table with glass vials, you always worry about objects just being embedded into the tissue. Glass is such a pain in the butt because you can't necessarily see it. Sometimes we can use our tools to probe into a wound and you can feel it.
Feel it!
But they're really hard to like get a hold of. Okay. Smacking your head on a metal pole and then getting knocked out. You always worry about somebody's airway and their neck. Look at that neck! As well as obviously the head. So if you are a bystander there, call 911, stabilize their neck, get them out of harm's way. Oh! Okay, wasn't expecting that. Lots of the red stuff squirting everywhere. If somebody were to be separated in such a way, you would rip major blood vessels. Obviously, you all know this.
We noticed.
It's almost like they have it to the whole blood volume just dropped out in 2 seconds. A lot of it would drop out, but not necessarily that fast because it's everywhere in your tissues. But you see organs laying next to this individual. They're trying to depict most likely intestine. So you're going to have small intestine, large intestine. The large intestine will probably still be kind of tucked and attached. They're all connected by mesentery. There's blood all over his face and probably into his eyes, into his mouth. You get worried about blood pathogens that you might have gotten exposed to. That's why we have OSHA here in the United States. You worry about, protecting yourself.
Most people, their brains grow till they're about 25, then stop forever. Mine doesn't. It regenerates constantly.
Oh, interesting. And as we get older, our brains actually shrink in size. You might not be able to regenerate your brain like this character, but you can support your brain function with supplements like Level Up by my company, Life Happens. Now at lifehappens.com and on Amazon.
Stab me in the heart, I die. Stab me in the brain, and the little goes back. I want you to put this inside me, in my eye, here.
What?
You give me a frontal lobotomy.
I was just about to say, one of the ways to do a lobotomy is going through the orbital socket next to the eye through, because the frontal lobe of your brain is accessed that way to a point.
Now, avoid the eye itself. I don't want to go blind.
See, so missing the eye, wanting to go next to it. Yeah. Shaky hands. Don't have a cup of coffee when you want to do this. Obviously, I'm not recommending anybody do this. Please do not do this. This is a show. We don't even do this in the hospital. Oh my! Come on!
Come on!
Eyes. Most people do not like eyes. My best friend's an ophthalmologist, and I don't know how he does it.
Now, use the hammer.
The hammer.
You're able to get into the eye socket, but using the hammer because you need to break into the bone. Oh my gosh, good noises. Not cool though.
It's not cool.
This is a blind procedure and you can cause injury to the optic nerve and the blood vessels back there as well as the muscles.
Again. Okay. Oh. Hammer down. Now. Scrape. Scrape my brains out.
What? Scraping the brain itself, causing injury to the right frontal lobe. So the frontal lobe has to do mostly a lot of times with voluntary movements, expressive language, higher level functioning, personality, those sorts of things.
Oh, God. Hey, are you okay?
Uh-huh. So, hey.
Yeah, so lobotomies are not performed today. Last lobotomy that was performed in the United States was in 1967, so it's been a while.
It's been a while.
Oh, buddy, what am I gonna do with you?
What?
Oh, stop.
When I talk to people and I ask them about diarrhea, I literally ask them, are they like peeing out their butt, like a liquidy diarrhea? But most people will also confuse like loose stools with diarrhea. Diarrhea is watery. What? What are you ripping through up top there? From the top shoulder over here, you got your clavicle, very easily broken. And I don't know if a lot of people out there have ever broken their clavicle. If you have, let me know in the comments. Oh, or rip the body in half. Connective tissue could potentially be stringy like that. We're not seeing any ribs necessarily broken, but you would break some ribs.
I don't need you.
We know he's super strong because he's actually even able to lift somebody up off the ground. A feat in itself, especially from your shoulders, and it looks like it's only one hand, so lifting that up, that's pretty darn hard to do. Oh, we knew that was gonna happen. Significantly torque and rotate to disengage the vertebral column and snap the spine is really hard to do. Probably the crunch is most likely related to the snapping of the connective tissue. Whoa. Oh gosh, what is gonna happen? We're gonna go right through it. Awful.
That's awful.
I'm assuming no creature was harmed during the filming of this. That type of impact at that speed, the passengers in the boat probably have massive amounts of injuries if you actually survive the impact. This is an event where the likelihood of survival is pretty low. There ends up being a lot of injuries that people get while boating.
I believe it was a boating accident.
Drownings or potentially infections due to the microorganisms that are in the water that you're in. And then you definitely have to be careful when it comes to the propeller. That is so powerful. It's like a small little fan, but going crazy fast. Ooh.
Come here, Ryan.
Now on your life.
Oh, we do get electrical injuries that come into the emergency department. You can get electrocuted by lightning, but more commonly, it's usually at like a workplace where people are like working on outlets or sockets and they get electrocuted that way, or with tools.
Take the away from my son. We love you, Ryan.
Oh, whoa, holy. Wow, the eye is now gone. You probably have a lot more water than blood come out. You probably have a combination of both. You've also now destroyed the back of the eye, which is where all the retina is, and your rods and your cones, so your ability to see is probably going to be now shot. Ooh. Sliced in half? What happened? Whoa!
I'm shot in einen Apfelbums.
Good job of showing what the tissue actually kind of looks like when there's such damage to the area. Basically almost like ripping or torn tissue. You see bone, you can see different colors, so they're trying to depict different layers of tissue, which is good. Oh, punching your hand onto a hard object. A mere mortal will actually fracture the heck out of your hand, most likely. We have what's called the boxer's fracture, which typically relates to somebody hitting and fracturing either the 4th or the 5th metacarpal. Seriously. We have an eye gouge. The cornea, which is over top of the colored part of our eye, is very, very sensitive and has a lot of nerve endings and is quite painful. This definitely doesn't happen that often. Most of the time we see open globe injuries or open eye injuries due to lacerations, and you see some of the fluid coming out.
Why don't you wait outside?
Oh, what the? I don't know. I'm trying to think of what this is like in real medicine. We see parasites, but the parasites are itty bitty little small. Sometimes we'll see pinworms or we'll see maggots. Nothing like this. This character is getting shot in the back, one right mid-chest, one lower. What structures are there that could get hit? On the right side, that's probably most likely hitting the lung. And on the left lower side, there's a chance it could hit the heart.
It's okay. We see nothing.
Could this just be soft tissue injury that happens to the face versus if they're going into the brain and eating it? This doesn't show up in the emergency department. Oh, it's gonna take off the arm. Definitely gonna take off the arm. The arm is gone. You can see from this view that the arm is taken off above the elbow. What would you do? You are correct. You're gonna probably tourniquet this. So you can do direct pressure, but there's major blood vessels, your brachial artery chills right here. That's a big artery and it's going to bleed a lot. So you need to decrease that bleeding or you're gonna bleed out and die.
Bats. I want you to take these bats and beat these gentlemen to death.
What? We do see people that come to the emergency department with blunt trauma from these bats, pipes, crowbars. They cause fractures, dislocations, internal bleeding.
I think maybe we should go.
Direct force causing your frontal lobes to just be gone. Typically, injuries like this end up from car accidents, falling off of buildings. Massive amount of force, typically not caused by a human. What? You see a ton of blood squirt up. When we have blunt force injuries, the skin itself will split open. Then you'll potentially cause massive destruction of the bones themselves, but a lot of times it's not totally open because you have all the tissue that's overlying it, so it's not like it's just a big open hole. Oh, whoa. Headshot. Boom, headshot. Sometimes, depending on where you get hit in the head, it's not necessarily going to take your life. It can cause brain swelling, can cause a lot of bleeding, could be missing brain tissue, but not every single headshot is a mortal wound. I love that we always want to punch people in the face. In your face! Remember, when you're hitting people in the face, you increase the risk of fracturing your own hand. What? Oh my gosh. It's almost like when cells divide. The sperm and the egg meet, and then cell division occurs, and it divides, and it divides, and it divides, and it keeps going. And it knows the blueprint of how to make a human. How amazing is that? Oh, straight through the cribriform plate, up through the skull. So it is hitting your frontal lobes of your brain, as well as probably your parietal lobes. This is most likely not compatible with continued life. They actually did a decent depiction of not instantaneous death, but hasn't injured the autonomic nervous system. It is causing significant amount of bleeding in the brain, which then can cause issues relating to it. What? What? The rubber duckies coming through the neck? What the heck is this? We do deal with injuries to the neck in the emergency department. People will have a trach, right? So they'll have their airway there. Sometimes it'll be bleeding. There's vascular problems that could occur. Oh my gosh, they're everywhere. Oh, is it just tripping out? Maybe it's just tripping. Visual hallucinations. People do come to the emergency department for that, unfortunately. We'll also have individuals with auditory hallucinations, usually due to a psychosis of some sort. A lot of schizophrenics that might not be on their medications, or first-time schizophrenic where they're hearing command hallucinations. Anytime we have somebody with visual hallucinations, we think, okay, could it be psychosis? Could it be drug-induced? Could it also be like a brain tumor or a stroke? We first always have to rule out everything before we just say, okay, it's some sort of mental health issue.
Frenchie.
If it is a true psychosis or a type of schizophrenia, we do have medications that will actually help with this. Oral medications or even injectables that can actually help an individual in this circumstance. Oh!
She just wanted some help tracking.
Oh, laser beam right to the head. Oh my gosh. Pull straight through, right frontal lobe, going straight through the parietal. Unlikely even hitting the occipital lobe. Your whole left hemisphere is probably gone. Not compatible with life, they're done. There are lasers that are used by different specialists. Ophthalmologists will use lasers. We will also have different types of lasers that might be used in different surgeries, neurosurgeons, back surgeons, and then definitely relating to your eyes. Oh, gross, but good depiction. There's a much larger hole on the backside because energy expanded, and it's still smoking because of the heat. And then we just have non-specific brain matter. The brain matter would be more white, gray, with some blood around it, versus this is more probably the soft tissue of the skull that we're seeing with the hair mixed in. Oh, what? What? Holy cow. Hemisected the body in half, not compatible with life in this scenario. The amount of blood loss, done. The aorta is cut, you've bled out of your body. You're not going to resuscitate and do chest compressions on this individual, because if you try to do that, it's just going to squirt blood out the bottom. Oh, man. Laceration to all the fingers. You want to control the bleeding. You might need to tourniquet it. You may not. You might be able to reattach them. But typically the ice blade is a couple millimeters wide. So it might be too wide of destroyed tissue to be able to reattach. But maybe. Oh, but see how it actually depicts that the blood is pooling out? Actually pretty close. You have 2 arteries on each side of the finger, so they will bleed and pump out pretty good. Interestingly enough, they show the amount of blood pooling out the middle hole. Not correct, right? As we all know from watching this channel so much, the major blood vessels are on either side, not the front. You do have a blood vessel there, but it doesn't pool out like that. People will get punched in the nose when they get into fist fights. Sometimes it'll be off and sometimes it'll just be bleeding or swollen. We can get images in the emergency department of it. We can get an x-ray, which really doesn't give you a lot of information. You can get a CT scan of the face, which will give you a definitive likely answer, but it's a lot of radiation exposure and you already kind of know the answer. Using a snake as a blunt force object is not usually how people come to the emergency department. Usually we end up seeing people come in because they've gotten bitten. Most common in Southern California would be a rattlesnake that has venom. Sometimes we'll do blood tests. We'll watch and wait and see how you do to determine do we need to give you the anti-venom or not. Oh jeez. We maybe see a little bit of organs flying around, but there are instances when people do explode from the inside out. One would be a ruptured AAA. Oh, I'm like, how did he just explode? There are times when the intestines swell so much that it's like a balloon in there, but you don't actually rupture because they're muscles, so the muscles swell up. The other one that's really common is urinary retention, where the bladder just gets bigger and bigger and bigger. Sometimes their bladder is so large that it's holding 2 liters of urine.
I know all about it.
Suck my fat.
Hemisected, transected the body, the heat of the eyes, cauterization. You actually might be able to cauterize some of the blood vessels when doing this, so you're not going to bleed out and die immediately, but you're still going to have some bleeding.
Where's Starlight?
Why would you die or pass away in these moments? Lower spine, almost at the pelvis, typically going to die because of blood loss. The kidneys are not going to be working appropriately. You're not being able to use your bowels appropriately. So eventually, you're going to go into renal failure and going to have sepsis and infection. This guy and his snake again. Oh. Oh, it's a part of him.
That's Willie!
Mutation related to compound V. People do have mutations, so to speak, born with a tail or an extra finger. Strangulation, decreased blood flow in and out of the brain, increase the risk of stroke, embolization, and then also compressing the airway, decreasing oxygen to your tissues, thus passing out. Ooh. The body's just getting tossed around. Normal people, this would cause fractures, bruising, contusions, dislocations. When somebody comes to the emergency department, you're going to evaluate that. You're going to do a primary survey, airway, breathing, circulation, a neurologic exam, and looking at the whole body. Being held up not only by your neck, but all your extremities can cause a lot of pressure to the area, decrease blood flow, even to your hands and your feet. If it's prolonged, usually greater than like 60 minutes, you really get concerned about ischemia to those tissues.
She's coming back. She's coming back.
Oh! Oh! Oh my goodness. Traumatic brain injury, brain matter and blood shooting somebody else in the face. Bloodborne pathogens you have to worry about. Blood going into somebody else's eye. The mucous membrane of the eye absorbs right into your system.
You don't get it, do you? Me, Homelander,
Oh.
your old crew,
Oh.
everyone you over.
somebody gets a car thrown on them, you're worried about traumatic brain injury, massive blunt trauma that can compress your thorax or anything into the abdomen. Majority of the time, besides stabilizing them first in, say, the trauma bay when you first see them, you will probably do a head-to-toe radiographic study, most likely a CT scan, head and neck. Oh, vomiting black. Interesting.
Interesting.
Isn't very common. We do see people vomit digested blood. Concerning for an upper GI bleed, meaning bleeding in your stomach or the first part of your small intestines, your duodenum or your duodenum. Oh, the rock guy too. Some sort of chemical exposure, warfare. Ooh. You can see that the skin is bubbling and swelling. So these are like papules that we see. Question if there's fluid underneath. Is it just swelling tissue? Is it just necrosing off? This type of bubbling skin, chemical exposure, you could potentially see this from mustard gas. Typically any like the chemical exposures that we see are more related to nerve agents as well as just environmental toxins that end up showing up in the emergency department. This show is the epitome of going from calm to chaotic in a matter of seconds. In life, we deal with high stress moments constantly. That's actually why I created Chillax by my company Life Happens. Designed to help support relaxation, whether you're watching intense face-offs like this or just dealing with your own stressful week. Check out Chillax at lifehappens.com or on Amazon. High cervical injuries. You always worry about chiropractors, right? Now, one plane of rotation going all the way around and you're basically trying to sever the spinal cord. Somebody who's doing chiropractic work or OMT, osteopathic manipulative therapy, you're going in 3 different planes of movement and you're only going in a very small speed and direction. Multiple gunshot wounds to the back and not doing a thing. A normal person that's going to cause a hemothorax and a pneumothorax and maybe some fractured ribs as well as maybe an injury to the heart where the bullets are going through. You will be able to survive a little bit longer. It just takes a little bit of time for the true effect of the injury to actually set in. I would do the same thing. It's just like, oh, you just bent a solid piece of steel. I'm out.
You know this, man? You are nothing but a coward. I said shut your mouth!
Soldier Boy's power. Massive radiation explosion energy. Radiation exposure is something that would come to the emergency department. There are decontamination protocols for most ERs because you don't want somebody running into your ER with all that radiation potentially still on them and then giving off to other people and exposing more people. Oh, what is he doing? He's squishing his head? Oh no. Could you actually, what? Look at the anatomy, this is awesome. Eyeballs are popping out, he's got blood coming out of his nose. Hearts are just popping out. Now you can have something called a retrobulbar hematoma, where you're getting blood coming behind the eye and it's pushing it out. Typically they just don't fly out of your head. The nosebleed, could that probably be happening from a fracture within the sinuses or the nasal bones? Yes, potentially. Oh, no. Can you squish somebody's head like that? Maybe if there's an imperfection in your skull, if there's already a crack in your skull. The amount of blood that got squirted out of there also isn't that accurate. Oh, so cool. Smash face and smashed again. Do you see that? It's missing the top of his head. You can see the mandible is still intact as well as the tongue, which is attached on the bottom part. Where's his brain? Where did it go? Where's his cerebellum? I want to see all that stuff. Oh, see what I'm talking about? That fish guy is destroyed. He just punched him to the gut. All I see is blood into the abdomen. You have multiple layers of abdominal muscles to the abdominal wall. But then you have your transverse abdominis, your obliques, bunch of different muscles there that are just overlapping everywhere. It should form like a good layer. Oh, 180 degrees cervical fracture. Could you actually do that? The rotation has to do with basically at the top of our spinal canal where they can basically rotate upon each other, but they don't rotate all the way around. Then obviously if you do that, could you then cause injury that's not sustainable with life? Potentially. Oh my gosh. Like, come on, who is this guy? And he just used his hand to like karate chop the guy's neck. Obviously, we know this can happen. The anatomy that you see there is mostly blood, but there is some bone in the neck, and maybe is that the spinal cord too. If you get a lot of trauma to your neck, when we see it in the ER, a lot of times it's penetrating trauma and sometimes blunt trauma. So you can get a knife, stabbing, laceration. We have multiple zones of the neck, and if it's in the middle zone, you have to have exploratory surgery so your major blood vessels don't have leaks or anything like that, including your carotid artery and your jugular veins that are all sitting right here in your neck, as well as the nerves that are flying down with it. There's a lot of fighting. I love it. What? Okay, there's a lot of blood. Oh, man. So I love how the blood's just kind of randomly splattering. It could happen if you get punched in the face or there's blood in your mouth already or go flying. What people don't think about is the fact that you're punching somebody in the mouth and then you can cause a laceration to your knuckles and your fingers. And if they're deep enough, now you can get into the joint itself and you potentially have an infection because the other person's mouth is dirty. Those wounds need to be washed out in the operating room. And now the amount of trauma that this head is taking with minimal damage, you're getting pummeled through the floor. Normally that would not lead to good circumstance in a normal human. Blood trauma, rib fractures, rib contusions, lung contusions. Contusion is a bruise, and that's when it changes different colors. It goes from like black and blue to green and yellow when it's healing and breaking down the blood cells that are there. That's why it changes color.
Duplicate. Monster Girl is in trouble.
Whoa. What? Okay, I hope that wasn't the real person. You have arms, legs, they explode, but they also explode in multiple pieces all over the place. And it's just a smattering of like jelly blood everywhere. Oh! Took blunt force trauma to the solar plexus and the chest. Probably just destroyed his heart. Each human body is probably about like 8 to 10 pints of blood. If that's under pressure and it gets ruptured, it's gonna squirt out of your body. And then up in that area too, you got your stomach, which is a hollow organ, which can just rupture. Oh, he's pissed. Oh, probably broken forearm. Your forearm is made up of your radius and your ulna. Those can snap pretty easily. And if they do, you need to have it fixed. You need to splint it. You need to get it realigned. Oh, and nothing like smashing your head against the ground and the wall. And he's dead. Holy cow. Think on somebody your own size. Oh, this guy's like super crazy strong. Whoa, that is messed up. Taking those hard objects, you're going to cause some fractures. With enough force, things do happen, but the strength of a normal human, unlikely.
Keep moving.
All right, we're in the hospital. Oh, they're not dead.
Clamp that vein.
Let's have a hospital where the guy's just bleeding out, looks arterial because it's just forcefully coming out. Nobody has pressure on it.
Skull fractures and cranial swelling.
Multiple skull fractures and cranial swelling. Fractures are open. So I'm assuming they're saying swelling within the brain itself. This is actually kind of good that there's multiple fractures. You don't want it to swell in a confined place, and that's when things herniate to the wrong areas, and that's when you die. A lot of times the neurosurgeon, if there is swelling in the brain, usually from edema, from bleeding, mass, or trauma, then they can actually do a burr hole and decompress what's called your lateral ventricle on the other side, which carries your CSF, to then open up more space so you can allow for the swelling.
She's drowning in her own blood. Get her intubated now.
Get the intubation. The doc grabbed a laryngoscope. It looked like what's called a Miller laryngoscope, so it's curved. It has a light on the end, and so you can actually look. It's a direct laryngoscopy, basically where you can open up the mouth, look inside, and then feed the endotracheal tube through the vocal cords.
The needle won't go in.
Whoa. Whoa. What the heck is happening? Whoa. Cool. Okay, so they did the right things by intubating and then the body rejected it.
Saline infusion of 2% belladonna root, 5% wolf's.
So these two plants are crazy deadly to human beings. So it's really crazy that they're actually using these two medicinal type dangerous medications to then actually give to monster girl to allow her own body to use these meds to help heal itself.
Nanosutures.
Nanosutures. Nano meaning like super small. I wonder what they're going to suture.
Fibrillating.
Fibrillating, what they're meaning is like when the heart goes into a specific rhythm, it could be atrial fibrillation or ventricular fibrillation. And it's just that, when it's fibrillating, meaning like kind of wiggling, not rhythmic, and there's no purposeful energy. Oh, super cool. Yeah, it's definitely fibrillating. Now is asystole. And as a shock, you should be doing CPR. Right when you shock, you do CPR, do 2 minutes, and then you go back and check the rhythm. Now they've shocked it, and you see in the leads, it's flatline. Flatline equals asystole, which means it is not a shockable rhythm, and you need to do CPR. Don't max charge anything. This doesn't work. There's no stacking shocks with no interval of CPR. Basically, you do CPR, defibrillate, get back on the chest, and continue to do CPR for 2 minutes, then recheck to see if they have a pulse and a rhythm.
You almost killed him!
Instead, you saved him. So much effort. For what?
Oh, what? You just destroyed that kid's head. Just squeezed it with his own hand. You actually see brain matter flying everywhere. No, you can't do that. No, none of us have those powers yet. Maybe aliens somewhere else do.
Did seeing that man lose his life disturb you? Did it hurt? Well, let's see how you handle this.
Oh! That is an intense hit. All right, there goes the city. Oh, it's a scratch. Oh, he just broke one of his eye shells. That is disgusting. Just a random arm, and the humerus is just like chilling out there. So the humerus is a single bone of the upper part of the arm. Most of the time, you can't reattach it unless it's like perfect. First of all, who doesn't want to be as jacked as that guy? The only supplement that I end up taking when I work out is creatine and a lot of water and maybe some coffee if I need some energy. To get that big, very hard to do. Oh, sweet. Does that actually happen? No, it typically goes right through you. You might be able to wear Kevlar vest, metal plates. Most of the time these are resistant to the bullets, but doesn't necessarily stop it. And you're also going to get the compressive force. It can break ribs or puncture a lung without even going through. I got a lot of money.
A lot of money.
And we got balls of white stuff, probably cocaine. Could also be fentanyl. As a physician, I do not advise or recommend any illegal substances. Anything that you do ingest should be doctor prescribed, nutrition prescribed, or something that you can get over the counter at a pharmacy or a retail store. Nice, just popping through, you know, brick walls, no problem. I see people who the brick wall bounces them back and they'll get concussions, intracranial bleeding, skull fractures. What?
What?
People will say, hey, you can get hit in the nose and it can go into your brain. If you have a fracture of your face that's so compressive that it compresses in, yes, bones could potentially go into the cavity where your brain is. Does it cause brain injury? Maybe, maybe not. It's always on an individual basis. I wouldn't be fighting this guy. Wouldn't you just run away? Ooh, blunt trauma to the face, blood splattering everywhere. That does happen. Half your nose is bone, half of it's cartilage. You can actually crack and break some of the cartilage there, but most of the time when somebody breaks their nose, they're breaking it at the bridge here. Just leave, people, come on.
Just leave.
Literally shot him right in the deltoid and went right back, shot him in his own forehead. We will see people who get gunshot wounds to the skull and to the head. Doesn't necessarily mean you're going to die instantaneously, but it does mean your chance of mortality is extremely high.
Tell Mr. Lou next time I find him on our turf, I won't be so gentle.
Well, he can't tell him now. He just snapped his neck. Just snapping your neck instantly kill you? No, the movies make it sound that way. But if you cause a spinal cord injury relating to the trauma of your neck, and if it's high enough, yes, it will prevent you from having the ability to breathe.
Did you have a good time?
Whoa!
Oh! What the hell is that?
That's what I'm saying.
Come on!
Run. Get out of there. We see people come all the time with ankle injuries. You can walk on an ankle fracture if it's lateral, meaning on the outside. That's if the fibula is fractured. It's a non-weight-bearing bone, so you can actually be able to walk on that, versus your tibia, which is actually the bone that you feel more medially or on the inside. Oh, geez. Whoa. Nice. These superheroes have that like crazy superhero focus. I actually helped develop a product called Level Up. Check it out, lifehappens.com. So he was getting strangled. We get people that come to the ED looking for help. About what to do with the pain. Our biggest concern is one, airway, is the airway swelling? And the other is, are the major blood vessels in the neck injured? Obviously, ton of damage that the superhero is taking. If this was to a normal human, every bone in that body would probably be broken with all that damage that is going on with the concrete and flying around and getting smashed and getting hit. Uh-oh. I want to see what this guy's face looks like. Oh, okay. We're missing the cartilage of the nose.
Your nose!
And you can see in that eye, it's all red where it's supposed to be white. And we actually call that a subconjunctival hemorrhage. It looks so scary. It's fine. Somebody please help me out there in the comments.
Help a brother out!
Blunt trauma to the abdomen. Might be the chest, but the abdomen's soft, right? The chest has your ribs and your sternum, so it's much harder to cause a puncture wound to that area. Then you worry about, besides your organs, the aorta and your inferior vena cava. It just seems like all that blunt trauma is just pissing him off.
You pissed me off.
People punch individuals in the face all the time. You're not only gonna break their face, but you're gonna break your own hand. Think about it. You have so many little tiny bones in your hand that you're going against big flat pieces of bone. Oh man, they're trying to eat his face. Oh my gosh. Our mouths are very dirty. There's a lot of bacteria in there. And I've had to, unfortunately, admit people to the hospital who get what we call cellulitis due to human bites. The bacteria just goes rampant, gets into the tissue, and then can get into your bloodstream. There's no spine, but there is the vertebral column or the bones of the spine, but there is no cord going down behind it. So you have the vertebral bodies, but normally the spinal cord would go right behind it in a canal.
Move it! Here!
Whoa!
3, 6, and 8.
I mean, everybody's wearing their PPE. This is pretty good.
Clamp that vein.
I love the stethoscope use. Looking to hear if you have breath sounds or not. You're looking to hear if there's a collapsed lung.
This is bad.
Oh, we got an open abdomen. Everybody's in their sterile gowns. We see intestines. Nice. That's kind of looking real. And on some sort of ventilator oxygen support.
It's dropping, people.
I'm on it.
Oh, geez. Pulse is dropping, meaning not enough oxygenation. Could be decrease in blood volume. Typically, if you don't have decreased blood volume, your heart rate is up. So it's a bad sign that the pulse is dropping. And then obviously you're seeing arterial bleeding just squirting everywhere. And most of the time we don't have viewing rooms at the majority of the hospitals here in the United States. Some teaching hospitals you do, but very rarely.
How long was I out?
6 days.
Whoa.
6 days?
Sometimes you can be out for many days in a chemically induced coma. Sometimes we'll sedate you. Sometimes you don't need to be sedated, but you're not waking up. And that's in this circumstance. And doctors don't know exactly when somebody might actually wake up. Oh! It's classic. Somebody gets punched in the mouth and they spit out the blood. It is quite easy to cut the side of your cheek, maybe bite your tongue, to have a little bit of a laceration. Sometimes you can actually lose a tooth, crack a tooth, break a tooth. And it's really interesting that they're able to punch each other so much in the face and nobody else is spitting blood. Blood Blood has that weird metallic taste. Some people are like, oh, I like it. I want to drink my own blood. Please don't do that. If you drink too much of your own blood, it'll cause nausea and you'll start vomiting.
Try and save lives! Why can't you trust me?
Oh, there you go. We got a little bit of blood splatter going out. Nice bloody nose streaking down. If you get a bloody nose, right, what do? Pinch your nose, lean forward. Don't lean back because the blood will drip back. You're trying to get it to clot and get it to stop.
After what Omni-Man did? After what you did?
Oh, was not ready for that. I can't believe they have this in shows. Literally an amputation of an arm. Looks like above the elbow amputation. And get a tourniquet on this bad boy. And tie it tight.
You!
Yep.
Yep. Whoa, wait a minute. Oh my God. Open fracture dislocation at the elbow. And actually, I need to make a point. The other arm that you see the amputation and the muscles, actually pretty good. You can see 3 distinct posterior muscles and 2 on the anterior. Whoa! A little bit of back fracture. That's not going to be good. We don't see too many of those type of injuries, like a scorpion injury where you're kind of bent over backwards. Majority of like the spinal cord trauma injuries are falls from big heights and they land on weird surfaces. Oh! I mean, this guy's nose bleeds a lot, but he's doing okay. Oh, geez.
Stop him! But don't kill him!
They're kind of stepping on him, crushing him. When you do that, you end up breaking bones. People have this occur when they go to like concerts sometimes. People get stampeded and you can't breathe. People step on your chest and you can't expand it.
Stop! There's too much power! You'll kill us all! Stop!
Oh my gosh. Explosions that the guy disintegrated. With all that massive power, you see some bone structures. If the heat is so hot, yes, you could probably burn pretty fast. You know, they do this with cremations where the crematorium or the oven is so hot that it burns pretty much everything away.
Your brain's scrambled. You've lost track of what memories are yours and which come from the others.
They're all my memories! All of them!
Oh my gosh, look at that brain or head. Holy cow, the brain is a little big.
You need a hospital.
Oh, vomiting some blood. If you're vomiting blood, it could be related from like a nosebleed that you're swallowing or bleeding in your mouth you're swallowing and then you're re-vomiting it back up versus an injury to your intestines or injury to your stomach could have bleeding, or you can cough up blood if there's blood in your airway. Oh, you can just snap your neck on a type of fall like that. Definitely if somebody came to the emergency department, they'll probably be in a seat collar and you get a CT scan on the neck, make sure that there's no spinal cord injury or cervical fracture. Oh, sound waves. Underwater creatures, I believe, communicate, or sonar, different cool things like that. I don't know if anybody's been close to a speaker before at a concert. It can cause a lot of pain, damage, actually rupture eardrums just because of the volume. Oh, punch right to the chest. So you have to be careful. You can fracture the sternum, which is actually a very thick, hard bone. And then you worry about the underlying structures that are underneath, aka your heart. Oh, down to the abyss. When you're down at a certain depth, right, you got to worry about your ears popping. You also have to deal with pressure regulation, and you also don't want to come up too fast because you can get the bends. I've seen that happen with fishing when I've done deep sea fishing where I brought up a fish too fast and the intestines came out. Oh! Ow! We don't see people getting hit too much with these type of things. Crowbars, hammers, baseball bats, anything somebody can get their hands on they use to hurt other individuals. You have to worry about the abrasions, the lacerations, and any underlying injuries to the tissue. Oh, what? You see intestines flying, you see eyeballs flying, you see a decapitated head. Ouch. I have a buddy who's a state trooper, and he tells me a lot of bad images occur during car accidents.
Look
Whoa.
who it is.
Whoa.
Let him go!
You can see open laceration in the left shoulder, bloody nose. You gotta put some pressure on these areas. That shoulder you can suture or staple shut.
You actually like this monster? Good.
Oh, cool. Falling from that great of a height is going to have a high mortality rate, especially going over and falling on a car or even on the hard surface. Any type of fall greater than 3 times your own height, you have a high index of suspicion for major injuries.
Thank you.
Left eye super swollen shut. Sometimes if you get a fracture of the inferior orbital wall and it communicates with a sinus, your maxillary sinus, if you sneeze or blow air too hard, you can actually get air to actually go into the tissue, dissect all the way around, swell up that eye and shut it real quick. What? What's happening? Oh, it's just like disintegrating and flesh is just falling apart.
Wait, no!
I mean, I really hope that the tissue is not floating in the air because now you're going to be breathing dead tissue and skin and get into your own airway. Kind of gross. Not sure. I've never seen something like this happen, obviously. I've seen rotting flesh when people get different types of gangrene, dead tissue, or tissue that doesn't have any good blood supply. That's typically why the tissue dies, but it happens over a period of time.
Stop! You're supposed to be good at it. Relax! Look, we've got at least 3 minutes until the police show up.
The gentleman that got tossed in the air and then the old school wrestling move that lands directly on the head, gonna snap the vertebrae in the neck, gonna cause compression fracture or a blowout fracture.
Boy, did you pick the wrong day to steal a timeless piece of America's history. She's single. Obviously, you two have had the hots for each other since, like, forever?
Oh, heat injury to the back. Could have second, third degree burns. Anytime you do get a burn, make sure that you take off the clothes that potentially got singed. If it's an oil or a water, get it off your skin. What you could do just to help with the pain is put a cool compress on that area, but the damage has already happened. Oh.
I'll kill you!
It doesn't really take much to actually cause a bloody nose. If you do get a bloody nose, pinch and lean forward, please. A lot of people pinch and lean backwards, and then the blood's just gonna trickle back into your esophagus. Swallow too much of it, it's gonna cause you to be nauseous and then vomit, and then increase the risk of more bleeding. Stop it, I was not expecting that. They did a good job of the anatomy and the splatter of the red stuff everywhere. Good structure of the vertebral bodies with the spaces, and we're seeing a process. Hard to know if it's a transverse process versus just a spinal process. Traumatic falls, that individual fell from a great height and had traumatic head injury, may still be alive, breathing, and having a heartbeat. They'll end up being transferred to the hospital for evaluation if they're still alive. We're seeing a lot of organs everywhere, bones ripping, skin ripping. We don't see this. They at least did a very good job of showing us intestine, and it actually is large intestine that they're showing us with some smattering of small intestine. People do have amputations, usually from high velocity injuries falling out of buildings, massive car accidents. You gotta make sure you put a tourniquet on it. And remember to bring the limbs. That way it's helpful if there's a replantation team available to put it back on.
Survivors will inherit a new world and learn that life is a gift, not to be wasted.
Oh, there you go. Could you break somebody's wrist that way? Probably really hard to do. You have 8 wrist bones and then you have the 2 bones of the forearm. You can snap or dislocate some of those bones, but typically the fractures that we see from the wrist is landing on it or potentially getting something stuck.
Lady, you don't know people.
Oh. Could this deliver too much energy to the heart itself? It could. There's so many different factors. But what we end up doing is just depending on the injury, depending on the patient's response, we may do a cardiac workup. We'll get an EKG, get some blood work done, make sure that there's no injury to the heart.
You think you can shut me up? Mark?
Oh. Cool. So that color does not look like blood. So these look like robots or whatnot or androids. Sometimes blood could look brown. If somebody has a GI bleed and they're bleeding in their stomach, they might vomit and it looks like coffee grinds. Oh, cool. Disarticulation at the elbow, really hard to be able to do, but we do see people that get a lot of dislocated, fractured elbows. They swell up really fast. We try to get images quickly and then try to put it back in place. Penetrating trauma right into the epigastric area. We're talking about like the stomach area. At the bottom end of your sternum, your stomach probably sits, changes position as you breathe because your diaphragm pushes it down. But your stomach's right there, your pancreas is right there, your transverse colon is all right there.
You're afraid I'll blow the whistle, huh?
This shot shows that there is a brain matter going flying out of the posterior aspect of the skull. Most of the time when we see injuries like this, it's penetrating trauma, typically relating to like a bullet, or massive blunt force trauma due to falls from great heights or car accidents. Brain matter is typically a little whiter. We have intestines. Everybody shows the intestines as tubing, but they're connected by the mesentery, which brings the nutrients to and from, and you need that, and it keeps it all together. What the? Come on, that was sick.
Come on!
We got bones, we got blood, we got intestines. Where's the liver? Where's the spleen? Where are the kidneys? The character flying through, eyes were open, potential exposure to bloodborne pathogens hitting the eyeballs, which then can be absorbed into your body. Oh, whoa. It's really interesting, the perception of the blood vessels squirting up. Your carotid arteries on each side of the neck will continue to squirt blood as the heart is still beating. But once the heart stops beating, it's not under pressure anymore. Watching these superheroes in action really makes you appreciate lightning fast reflexes and laser focus. That's exactly why I formulated a level up designed to enhance focus, mental clarity, and energy levels without the crash. Check out Level Up at lifehappens.com or on Amazon.
An inferior species.
Oh, that's the liver kick if I ever seen one. You could hit somebody's liver pretty good just doing that type of kick on the side. You could fracture ribs, you can puncture the liver with the ribs, or you can cause a pneumothorax or hemothorax. Oh, the nose itself, it's all cartilage in the front here for all the people out there who tell me it's bone. The bone is higher up, it's half the part of your nose. You're just rupturing blood vessels relating to your septum and maybe a little bit one of your turbinates on the inside. Oi.
Anything to say in your defense?
Bleeding from the nose, you can have nasal fracture, you can have maxilla fractures, or an infraorbital wall fracture. If you do have a potential fracture on your face and you have to sneeze, let it out, don't stifle it. If you stifle it, you have an increased risk of the sinus being fractured and air getting out. It's like he's fighting himself. Laceration to the forehead. They bleed a ton. Super easy. Get some gauze, tissue, wet the tissue, put direct pressure on that area. Push hard and hold it. Knew that was coming. That is crazy. Holy shnikes, come on.
Come on!
You see that right eyeball just fly out, and it's got a little worm tail on the end of it. The eye itself, it's got 6 muscles plus the attachment of the optic nerve. Come on.
Come on!
All of these pretty much not compatible with life. I've seen in comments before where people are like,
oh, I know somebody who's been hemisected and they survived.
The likelihood is pretty darn low, especially in a traumatic injury like this. Oh my gosh. I don't know if it's superheroes, but maybe a train going through people can do this. Massive speed, heavy weight, trains, planes, automobiles, falls from great heights, explosions, those sorts of things. Oh. Oh. Injury to the mid-femur causing an open fracture. Open fractures means that it's open to the outside world. Why do we characterize it that way? Because it increases the risk of infection. Oh, uppercut to the face. You always worry about the tongue being in the way, your lip being in the way, or even just your teeth breaking. The mouth is really dirty. Anytime that you end up having a bleed or a cut, we do worry about infection in the mouth. Oh, what the? Penetrating trauma straight through the abdomen, not compatible with life. Your spinal cord is gone. That amount of bleeding ripping through your aorta as well as the inferior vena cava.
Please. I can't do this without you.
Right-sided facial destruction, open tissue. It looks more like bleeding because I still see the tooth and the gum still there, but a lot of cheek or side of the face is missing. If this were to be fixed, you need a significant amount of plastic surgery. Oh! Forearm fracture, broken right at the elbow, coming out the skin. That is the ulna, which makes up the olecranon process. That's coming out of the skin. Remember, antibiotics, put it back into place. Surgery for this. It looks like it's coming from the wrist, but it's actually from the forearm itself. The forearm is made up of two bones, the ulna and the radius. Oh! Human bites do come to the emergency department, surprisingly. They're almost dirtier than an animal bite. We typically will give augmentin or a different type of penicillin type derivative. That antibiotic will cover most of the pathogens that are in a human bite. Where he bit was more onto the trapezius, not necessarily the neck. So the neck harbors your jugular vein and your carotid artery versus the trapezius or high up, just regular small blood vessels. The major ones deeper to that are protected by the clavicle, which would be your subclavian veins.
And me for you, boy.
Oh, crush injury to the hand itself. You could be fracturing and crushing all the metacarpals of the hand or your phalanx. There's a lot of injuries to the hand, a lot of bones. Amputation above the elbow, but look how clean that is. Because of the cleanliness of the cut, it does potentially have the ability to be replanted if you're at a facility that has a replantation team to be able to reconnect all the appropriate vessels and nerves to give this arm a chance.
Oh man, so gross.
I like the response of, oh man, it's so gross.
That's gross.
If this were to happen in real life, the proximal end needs a tourniquet on it or the bleeding to stop. That way this has a chance the person is still alive, they're not bleeding out. Do you tourniquet this or not? Typically no, it's a low flow state, but you want to get to the hospital as soon as possible before tissue starts dying. Ooh. So punch to the face. Everybody punches everybody in the face. Lacerations to the hand, open joint injuries, and then it hurts your own hand, increase the risk of a boxer's fracture, which is typically a fracture of the more lateral metacarpals.
You guys are so good.
Oh, we're doing a lot of open fractures here. Oh. Whoa, 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 whoa. Decent job of showing us some weird intestines on the inside. We're very limited. Not a lot of imagery to go off of. We're missing organs or bones in this area. They're all missing. Not a survivable injury. Oh, example of like the weakness of our bodies, and it's the neck. Look at that neck! It's the open area to injury. It's where major blood vessels are, and even our cervical spine. If anything were to happen to the spine itself, then the rest of our body is useless. When the head is separated from the body, not compatible with life. Ah! Come on! Come on! It's almost like ballistic gels, bowling ball through a body, and it just disintegrates it. Just be careful, don't hit the lower part of your frontal bone. That's where your sinuses are. Remember that the whole nose is not bone. Half your nose is bone. The rest is cartilage. It's the upper part that is the bone. Ooh. Interesting.
Interesting.
Blood came out of the ears. The bleeding is because of the rupture of the tympanic membrane or the eardrum themselves because they have blood vessels there. The bleeding coming out the mouth could be related as well because you have your eustachian tubes that connect from the posterior aspect of your pharynx getting in and out of your middle ear.
Hit door! It's me! Stop!
Watching scenes like this, your nervous system wants to spike. Your heart rate goes up. That's one of the reasons I formulated Chillax by my company Life Happens. It's designed to help you stay cool under pressure. Check it out at lifehappens.com or on Amazon. Oh, we got replicas. Interesting.
Interesting.
We got Dolly, right? The sheep that got cloned. Is cloning still going on? Have we all of a sudden forgot about our cloning technology, or is it going on behind closed doors? Let me know in the comments. Replicating so much, it's almost like cancer cells. The same cell just replicating itself, replicating itself, replicating itself, replicating itself, replicating itself.
You're repeating yourself. You're repeating yourself.
And going and going and going to where our machinery can't control it, stop it, just like this. They're gonna start to explode. The lack of space. It's almost giving the scenario of when somebody is at like a music event and they've gotten trampled. This is what happens. People just get stomped on, squished, there's no space, or they can't breathe because of the area that they're in. There you go. He's in prison. We do see a lot of prisoners at hospitals that I work at due to proximity. Common things that we see, fight injuries, so a lot of hematomas, swelling tissues, lacerations, fractured bones. Sometimes people will want to get out of the prison, so they'll end up doing nefarious things like swallow objects, stop eating, go on hunger strikes, and then end up having issues relating to passing out. Yep, does have control of it. Wow. I mean, that's a cool skill to have. If you had a superpower, what superpower would you have? Cloning yourself, combat skills, flying. Let me know in the comments. Electrical injuries, maybe those electrical devices are causing a short circuit of your nervous system versus electrocuting the heart and having the heart stop because of the energy that it's providing.